Hey guys, welcome back to my channel. If you're new here, my name is Kathy from Nurse Kathy's World. Please do me a favor by subscribing and push the notification bell to know when I upload weekly videos. This one We'll get straight into it. I have a very short video for you today. It's 2 easy tricks to answer priority questions on the Nclex. Those questions are so common in the Nclex, so you have to know how to answer them. Questions like, which patient would you see first? What is the nurse's first priority? And what is the most important intervention are priority questions. So keywords to look for when you're answering priority questions are first, priority, and most important. Priority questions are written at an analysis level, so it is very important for you to understand and recognize them so that you can answer your questions correctly on the Nclex. Any of these words that I just said about first, priority, and most important are clues that the question is assessing your ability to prioritize as a nurse. So 2 easy steps that I have are nursing ABCs and the Maslow's of hierarchy of needs. So for Maslow's of hierarchy of needs, I'm just gonna say MHN. All right, so let's get into it. So nursing ABCs: airway, breathing, circulation, and most importantly, safety. Most people forget about the S, safety. You have to keep that in mind. Once you know what's important, then it will become very easy for you to answer the question. And then the reason why they want you to know about prioritization is because as a nurse, you will multitask. You'll have 2 to 8 patients with different needs and urgencies. So it's very important for you to know how to prioritize, okay? When you get a priority question, you have to determine if it's going to implement airway or MHN in there to answer the question, to make it easier for you. So, for example, when you get a priority question, you know it's a priority question, then in the answer, you determine what they're asking you, and then on the answers, you have to implement, let's say, the ABCs in there. If they're asking you for airway, then you're gonna determine if it's physiological need that they're asking, because it's the most important. The Maslow of hierarchy of needs is a pyramid, like the food pyramid, and there's 5 needs in there. Physiological need is the most important. Physiological need is breathing, things that you need to survive: breathing, food, water, sex, hemostasis, and excretion. So that's very important. Once you see a question and it has the airway and physiological needs in there, that's your answer. Okay, if those are not in there and it's asking you a question and it's you determine it's a priority question and there's breathing in there, okay, so breathing, you have that in mind. And then when you go to the Maslow's of hierarchy of needs, if it's asking not physiological needs but the second one, which is safety, since they're not asking you for physiological needs, they're asking for safety, then you should keep that in mind. Breathing and safety in mind to answer the question. So these 2 are very important: ABCs and the Maslow's of hierarchy of need. Once you know those, you use those tricks to answer your questions, then you'll pass your priority questions, right? So that's it. In conclusion, make sure you have your ABCs. You know your ABCs: airway, breathing, circulation, safety, and the Maslow's of hierarchy of needs, which is physiological needs first, safety second, love and belonging third, Fourth, self-esteem and self-actualization. Once you have these two, then you have no problem answering your questions correctly. So to end this video, I'm just gonna do one question with you. Priority question. So I have the nurse plans care for a client in the post anesthesia care unit. The nurse should assess first the client's. Okay, so how do I know this is a priority question? Because it's saying the nurse, keyword first. The nurse should assess first the clients. So let's read the answers. A, respiratory status. B, level of consciousness. C, level of pain. Or D, reflexes and movement of extremities. All of them are important. Respiratory status, level of consciousness, very important. Level of pain, reflexes, and movement of extremities. But one of the answers priority. So let's go back to our ABCs and Maslow's of hierarchy of needs. ABCs. A stands for airway. So let's look for airway and these answers. So it's not level of consciousness, which is important as well. Level of pain, nope. Reflexes and movement of extremities, very important. So the answer is gonna be respiratory status, right? Because assessing the respiratory status is the first priority, because when you go back and you think about ABCs, airway is the most important. You got to make sure that your patient has patent airways. And then the Maslow of hierarchy of needs, physiological needs, which is in their breathing, food, water, sex, sleep, hemostasis, and excretion. So breathing is the most important physiological need. So it's airway and breathing. Respiratory status is the answer, right? It's very easy. Okay, so this is the end of the video. Thank you for watching. Please don't forget to hit the subscribe button and push the notification button so you know when I post weekly videos. Toodles, bye.